Hey, everybody. Welcome to DocTalk. We have a very special guest today, Dr. Ellen Joseph. And Dr. Joseph, will you tell us about your specific expertise and why you're here today on DocTalk?
Yes, thank you all so much for having me. Again, Dr. Ellen Joseph. I'm a licensed clinical health psychologist and partnership liaison at GI Psychology. I'm so excited to be here. While my expertise and work primarily focuses on treating GI disorders, there is such a strong overlap between folks with either a diagnosed eating disorder or even just disordered eating history and disorders of the gut-brain interaction, as well as IBD. And I think this is such an excellent opportunity to get that word out and help folks get connected to the treatment they need. Because for many of us, it's multiple spokes on the wheel to get to the various treatment goals we're working towards. And I'm excited to be here to talk to folks about what this one spoke could look like.
For those who don't know what IBD means, can you tell them?
Absolutely. So IBD stands for inflammatory bowel disease. It's a structural GI disorder. So when gastroenterologists conduct a colonoscopy or lab work, there are very clear indications of inflammation or ulceration in the GI tract.
Thank you.
Crohn's and ulcerative colitis.
Microscopic colitis. So that one's a little
Yeah.
bit different in how they figure that one out. But yes.
Do you also just go out with IBS, or is that quite different?
Yeah, so IBS falls under this really big umbrella term, disorders of gut-brain interaction. Historically, if anybody on the call is familiar with the term functional GI disorders, in 2016, that name got changed. There's a lot of stigma associated with the word functional GI disorders, and really disorders of gut-brain interaction better explain what's going on for folks who are experiencing these symptoms. But IBS is one of many diagnoses that falls under that umbrella.
Thank you for clarifying that. So we are so excited to have you because as Dr. Knopf and I are constantly encountering so many of our eating disorder clients have gut issues. That's my umbrella term. So why don't you kick us off by telling us what you feel like is the most important relationship between IBD and eating disorders?
Yeah, absolutely. So maybe first, if I could talk a little bit about just what the gut-brain interaction is, in case anybody on the call isn't really familiar. Our gut and our brain are constantly in communication, and they do this through our nervous system. So this involves our central nervous system, which is our brain and our spinal cord, and then our enteric nervous system, which is our gut. And they're just constantly communicating all day. When we're hungry, when we're full, when we have stomach flu. I know neurovirus is really big right now, so many of us are having our gut-brain interaction talking a lot to us. But this is really normal for that communication system to be exchanging messages back and forth. And for many of us, and we'll talk about kind of prevalence of these concerns a little bit, that communication system goes awry. Things like genetics, infections, chronic diarrhea, chronic constipation, life stressors, chronic life stress. And now all of a sudden, this communication system is talking way too much. Sensations in the gut that previously might have been a feeling of hunger or kind of that gurgling feeling that we get after a meal when something's moving through. Well, now all of a sudden that sensation is getting distorted and magnified. So now folks are feeling pain, they're feeling nausea, they're feeling these really debilitating symptoms, which then of course the brain starts to respond. It's like, well, that's not good. And it gets really hypervigilant. So that together with those magnified and distorted sensations, which are called visceral hypersensitivity, we get this really vicious cycle. So for folks, that can result in disorders of gut-brain interaction, such as IBS, cyclic vomiting syndrome. There's 33 different diagnoses for adults and 17 for children. So there's a lot of different ways that folks can meet criteria for these diagnoses. But this can also co-occur with things like inflammatory bowel disease as well. So those two things aren't necessarily mutually exclusive.
You just at least a quarter of the people I know, and I guarantee you none of them have this information.
No. If anything, to your exact point, this is such a complicated component of etiology and then recovery too, because you're really trying to figure out what's chicken, what's egg, what came first, right? We already know that malnutrition can cause visceral hypersensitivity, gastric hypersensitivity, and changes how cues and messages are relayed between the gut and the brain. But I think it's harder for clinicians to really get at, was there something else at play before someone proceeded into a behavioral pattern that led to malnutrition? So what would you say to a general practitioner who maybe isn't as familiar with eating disorders if they have someone who shows up with gut issues? I feel like that's a really poignant thing.
Totally. For the chicken or the egg conversation, sometimes we never actually know what came first. I think I often say to folks, sometimes it's just kind of things building over time. And whatever that thing was that pushed it over the edge, now we have these co-occurring concerns. But for our folks who do have eating disorders, research shows us that like anywhere from 40 to 95% of these folks meet criteria for a disorder of gut-brain interaction. Now, that is a big range, right? Depending on who's being studied and what population. But nonetheless, 40 at our lower end, that's still a lot of people. And I think for a lot of these folks don't know that this additional type of treatment is available, because we do see as well, even after folks go through their eating disorder treatment, these DGBIs can actually persist afterwards. So it's important because the treatments are a little bit different in the approach and how we can help folks really fully experience comfort and safety in their body again, which is really key.
What I'm hearing is you don't have to pick one nail to try to hammer. You can actually do a couple at the same time, which
Absolutely.
makes a lot more sense for holistic healing.
Totally. And I often work with folks and, we decide for each patient what feels kind of most important for them. If it is really overwhelming to work on multiple things at once, totally fine. What's kind of the first treatment you want to go through? And then we know that the additional ones are available. Or some folks are like, no, I want to dive in and I want to have my really holistic care happening concurrently. So there's not one right way to do it. I think it's really up to you as the patient to figure out what feels best to you and what makes the most sense. I think what I want to make sure to convey is there's hope that even after you go through recovery with your eating disorder and you're still uncomfortable physically, it doesn't stop there. There's still more treatment you can receive to truly feel better in your body.
Before we move into some of those treatments, which I'm sure many people are unaware that there's anything even available, I really love that you guys are highlighting how complicated etiology or causes are, and that humans are just such complex systems of brain, gut, body, genetics, environment, culture even, and we crave a simplistic cause and a simplistic solution. But unfortunately or fortunately, or it's just the way it is, it's always complicated, right? And so chicken and the egg doesn't necessarily help us ultimately because we're still dealing with a complex problem.
Totally. I will say with inflammatory bowel disease, we see the relationship a little bit different, where often the eating disorder is actually developed after the IBD diagnosis and also can persist even after IBD is controlled through treatment. So that one can be a little bit trickier in terms of relationship. But then again, I'm sure there's somebody who exists that was experiencing their eating disorder prior to and then got their IBD diagnosis. So it doesn't have to be one way or the other. And I know it's easier for me to say as a clinician than as when you're going through it personally, but I often, recommend to folks, instead of pouring so much energy into like pointing to the thing and to be able to say like, this is it, this is what was first, and this is what caused everything, that doesn't actually really change your experience of symptoms. So could we actually put that energy and focus to what can we do now to help you experience relief and kind of learn to tolerate some of that uncertainty of not having that clear 1, 2, 3, 4, 5, and this is how I got here, because we just don't always have that clarity, unfortunately.
We don't know as much as we'd like to, that's for sure. So, But this is so optimistic and hopeful that there are treatments. So
yes,
tell us about treatments that exist or can complement ED treatments.
Absolutely. So I want everyone to brace themselves. I'm about to drop the word hypnosis on this call. And I have to fully admit, I had a horrible experience with hypnosis the first time I witnessed it, my senior night of high school. The senior on the football team, the biggest guy, was like quacking like a duck on stage. So like this stood out to me, that when I started getting my hypnosis training, I was thinking like, well, I don't want to do that. So gut-directed clinical hypnosis is one of the things we do, and it is not entertainment hypnosis. So, and TV shows right now, there's like a whole new thing where everyone's coming back to hypnosis again. But that is not what we're doing. Clinical hypnosis
You're not telling people to pretend their shoes are puppy dogs and snuggle with them.
No. Or one of my preteens was like, are you going to have a magic word that you say? And then all of a sudden I'm going to be in trance. And I said, no, I'm not going to do that either.
I just want to name none of that's actually as real. There's more science behind like actually disproving that that's not really what's happening. But power suggestion, y'all, it's real. But anyways, please continue.
Yeah. So in gut-directed clinical hypnosis, essentially we're helping folks go into a trance on purpose. And a trance is a combination of concentration and imagination. And in fact, everyone here has experienced a trance in their life. It's a very naturally occurring state. So if anyone's been on their way to work, listening to a really good audiobook, and you pull into the parking lot and you're like, I don't even remember driving here. Like, when did I even make that turn? You were in a trance. If I have athletes on the call, the flow state that comes with athletics, and it's something you can come in and out of, but when you're on that run and you're like, oh my gosh, I just ran 2 miles. Like I wasn't even totally tuned into that. That's being in a trance. I have folks who, when they're reading, totally tune out the world and they look and they're like, oh my gosh, I just read 5 chapters. It's been an hour. I had no sense of time. This is a trance. So we're helping folks learn how to use this naturally occurring state to help promote healing in their gut. And there's a lot of evidence behind this, decades, in fact, of research behind the use of clinical hypnosis for GI-related issues with incredible efficacy rates. So, for example, with folks with IBS, clinical hypnosis will result in significant symptom reduction for at least 80% of folks who do the treatment, which is really powerful.
So many people. That's incredible.
Yes. And then we'll do that alongside with a gut-directed cognitive behavioral therapy, which is a little bit different from like your bread and butter CBT. We use very gut-specific protocols and apply CBT principles, but to your symptoms, and really working on things like relaxation skills and reducing that hypervigilance I was talking about earlier, or exposure exercises to different feared foods or situations. There are lots of ways that we can apply it specifically to the gut concerns.
With the hypnosis, then, is the aim building up that interoception or internal feedback? How do I check in with my body? How do I understand the cues? How do I guide the cues? Like, can you give a little more detail of what the target is and what the transition process looks like?
Absolutely. So this is an excellent question, because I think hypnosis and meditation can feel like they have similar threads, but they are different. So when we're doing hypnosis, we actually want folks to kind of disconnect from their body.
Okay.
We want them to shift the attention away. And there are lots of techniques we do to make this happen. But what happens is when you're able to kind of disconnect, that parasympathetic nervous system gets really activated. You get to this really relaxed state, this really comfortable state, and a place at which your subconscious mind is a lot more suggestible. And that's when we incorporate these gut-specific suggestions that are promoting healing, that are promoting turning down that visceral hypersensitivity, that really overly activated nervous system that we talked about in the beginning deactivates. And now all of a sudden I'll have folks tell me, 4 or 5 sessions in, wait, I feel hunger again. Like, I don't feel that nausea before meals. And that to me is like such a good indicator that we've gotten that nervous system back on track.
Wow.
Incredible. I never guessed that. That's incredible.
Mm-hmm.
So I also wanted to, you've mentioned that you guys work with POTS at your clinic.
Mm-hmm.
And that's something that I've encountered as an eating disorder therapist. And I'm curious about the overlap, if any, there. And is your treatment for POTS similar to the ones that you just described?
Yeah, really good question. So we see with folks with POTS, there can absolutely be gastrointestinal symptoms that can come along with that diagnosis. So we can, of course, target those in our treatment. And we also know the autonomic nervous system is really involved in POTS. And when we are incorporating hypnosis into treatment, we're really working on your autonomic nervous system. We're working on deactivating that sympathetic, activating that parasympathetic, using tools and teaching you tools to feel like you're more in control of these sensations and experiences in your body. There are lots of cool ways we can individualize that for folks so that whatever kind of presenting symptoms or concerns they have, we're teaching them these tools and we're helping them feel safer in their body, right? Because with a lot of these concerns, those feelings of safety can really disappear, right? Where the body can actually feel like quite a dangerous place to be. So we work with folks to kind of regain that safety, which benefits your autonomic nervous system. Lots of different ways to tailor and adapt treatment for folks with POTS.
And so POTS may have an overlap with eating disorder because of malnutrition, but that's kind of a big question still at this point. Is that your understanding as well?
I can't speak to that one as much. I don't know, Dr. Knopf, if you want to speak to that a little bit.
Yeah. POTS, by the way, it stands for postural orthostatic tachycardia syndrome. So it has to do with when you're changing positions, you have a change in your heart rate where it goes faster than expected. And you can have a lot of other physical symptoms with it. There's lots of treatment approaches. Is it about hydration, salt content? Is it heart monitoring that needs to occur? But ultimately, for those that didn't have issues with their cardiovascular system before their eating disorder and then they do afterwards, we do believe it's that malnutrition that increased the dysautonomia, knowing that the entire body was affected by malnutrition and that the signals are probably just not fully tuned in yet. As far as how long does POTS last, when people get it, I usually give anticipatory guidance that it's like in this first year, I expect you to have more symptoms, but after your first year remaining in a fully restored nutritionally form, that should start to improve. But some people don't. Some people's wiring is stickier. We already know this. Now, do I have any clinical way of proving that? No. That's a long way of saying yes. And I think there's also a chicken egg component. Often there is genetics, I think, related to this. You find out, mom always had problems with heart rate management, or there was an aunt or grandma had, and again, it's not just in females, it's males too. So I think it's very individualized, but ultimately that's really a cool concept to think about, using hypnosis to retrain the autonomic nervous system. I never really thought about it in that way. We talk about reducing the amygdala and the release of epinephrine or adrenaline when you're in the sympathetic response, but we don't really necessarily look at the modality of increasing, vagal tone and parasympathetic nervous system. That's very cool.
Absolutely. Yes.
Well, Dr. Knopf, do you have any other questions, or do we want to move into the last portion of our seminar here?
We forgot to give our teaser at the beginning, but hopefully you've stuck around till now, because guess what? This Doc Talk has an experiential exercise for you. And no, again, we're not just going to be hypnotized in this recording, but this is for everyone watching and us included. So Dr. Joseph, take it away.
Could I put in one more plug before we jump into
Yeah,
that?
you can.
I think a piece I always like for folks to understand too is there is a strong overlap between disorders of gut-brain interaction, IBD, and mental health concerns. So especially for our folks with DGBIs, we see a strong overlap with eating disorders, a trauma history, anxiety disorders, as well as neurodivergence, actually. And then for our folks with IBD, we see very high rates of anxiety, depression, and post-traumatic stress. And so it's so important when there are these co-occurring mental health concerns that we're treating those as well, because they are going to feed this system that we're talking about. And it can be bi-directional, right? It's not you're anxious and you're making your stomach hurt, right? It's not just be less anxious and you'll feel better. It's how do we work on all these different pieces to the puzzle to reduce that nervous system activation, or in the case of IBD, reduce inflammation in the body?
I love that plug. And thank you for naming it, because it is so validating. So many of individuals who experience these symptoms hear more invalidation or denial or minimization of just how intrusive and interfering these symptoms are. And this modality as a whole and kind of conceptualization gives so much more credibility and validation again to what they're experiencing. I think that alone can be so therapeutic.
Totally. Your symptoms are real, no matter if it's coming from inflammation, if it's coming from the nervous system. We're just better at measuring some of those things than others. It doesn't make it any less real, but great treatments exist.
Totally. Our science has not allowed us to check everything and test everything.
Exactly.
And I imagine that there are not enough practitioners that know and practice what you do. And we need about 1 billion more of you, Dr. Joseph. But in the meantime, how do people find you? And before we go into our last exercise.
Absolutely. So GI Psychology, you can find us at www.gipsychology.com. We try to keep it pretty simple. We're also on Instagram as GI Psych USA. You can find us on Facebook, GI Psychology, and on LinkedIn as well. If you're interested in treatment, go to our website. You can sign up for a free 15-minute phone consultation. There's a really easy link there. A member of our team will meet with you, learn more about your concerns, and get you matched with a clinician that's a really great fit for you. So please don't hesitate to reach out. We also are running some groups if you're interested in more of a workshop setting. So definitely check out the website and let us know if you have any questions. We'd be happy to help get you matched to the treatment.
You're licensed in all 50 states.
Yes. We can see everyone in the entire U.S. So there's no limitation there. So completely virtual. So definitely know that as well. We do make sure that you have a good virtual setup. But yes, fully virtual and all 50 states. And kids 6 and up. I'll put that plug in as well.
Wow. So you really are an all-purpose. Do you guys have a long waiting list right now?
We actually do not right now. We are actively adding more clinicians. We're up to 13 right now because we had a really long wait list, and it's something that is a really big priority for us because often when people are reaching out, they're really struggling and don't want to wait. So right now, maybe a couple weeks max to get you into an appointment. If you have more limitations on your schedule, maybe a little bit longer, but yeah, we can get you in pretty soon.
Amazing.
Incredible resource. Thank you.
Yes.
Okay, I'm ready.
Okay. So, We talked a little bit about the relationship between mental health, stress, and some of these concerns. So I thought, since we're in a world these days where just stress is very apparent, probably anywhere that you turn or look, we could do a little mental box exercise to help with coping with stress. So it's inevitable for us to feel stress in our lives. It's inevitable at times for it to feel upsetting. The challenging part is when there's nothing else we can do about it, how do we actually set it aside? How do we actually contain the stress so that we can be more present in our lives and connected to the things that we really value most? Let's do it. Let's do it. So I just want everyone to find a comfortable position and then go ahead and close your eyes. Or if you're not comfortable closing your eyes, you can just gaze down and just start taking some slow, relaxed breaths in a way and at a pace that feels good to you, just allowing you to focus in. What I'd like you to do next is just check in and listen to your body without judgment, without any attempt to change anything. Just notice what feels comfortable, notice what feels uncomfortable, and don't do anything with it. Just be aware of it. And then bring your attention to your breathing. Again, don't do anything with it. Just pay attention to it. Little interesting fact about breathing. When we breathe in, a little tension is created. And when we breathe out, a little relaxation occurs. See if you can pay attention to that right now, allowing that relaxation to settle in. Just by paying attention to your breathing, you are allowing yourself to relax. It's good. So we've done that physically. Now let's clean out the box mentally. I want you to imagine a box. Maybe your box is floating, maybe it's on the ground, maybe it's clear, maybe it's made of steel. It does not matter. Whatever you want it to look like is just right for you. Take a moment to really let that picture of that box come into your mind clearly and vividly. Now keep that box there, wherever it is in your mind. Now I want you to pick the first thing that pops in your head that's annoying, worrying, scary, and turn it into an image, a representation of some sort. Maybe it's a picture of someone's face, maybe it's words, or maybe you choose to make it an object. Doesn't matter. Just something that represents this thing that's stressful and worrying. Take that image, pull it out, and put it in the box. Good. Now pull the next thing out that's making you stressed, nervous, or worried. Turn that into an image or an object, whatever you choose, and just put it in the box. Put your images in the box. Take your time. There's no rush. Anything that's worrying you or stressful, turn it into an image and put it in the box. And then when you're ready, close that lid. Now these things like to try to sneak out of the box, and when it happens, it's not a problem. Just turn them into an image again and put them right back in the box where they need to be. Now, right now, with that box closed, maybe if you're fancy, you put a little lock on it to keep it extra secure. Notice what you feel like with that box closed and all your stressors inside. Enjoy doing nothing for this moment. An extra thought pops up, turn it into an image, and put it in the box. Now, before you open your eyes, I want you to pick the very next thing that you're going to be doing today. See yourself, the best version of yourself, doing that thing. And it does not matter what that thing is, big or small. And then step into that version of yourself as you open your eyes. How we doing?
The visualization like an old school computer desktop for some reason, even though we have desktops even now. And every single image that came up was like an icon, or file. And then my box, as much as I wanted to decorate it like a present and make it pretty with the wrapping paper on it, it was a brown Amazon box with Amazon tape on it.
You know what? And that's the cool thing. Let your mind choose it and make the box.
It was so funny, but then it really was that like big logo, then into the box. Zoop into the box.
Perfect.
What about you, Dr. Hannah?
So my box was clear, kind of like the frames of your glasses, Dr. Knopf, because I love this idea of like decluttering, and even that my decluttering is organized and looks beautiful. And I was putting things from raising kids that I stress out about, the political climate currently that I stress out about in the box. And I think that's going to be such a useful tool of visualization to put me in a more calm space, right? Where I can do my best work. I can connect with people the best. And it's a beautiful visualization. And I'm going to carry that with me. Thank you so much for sharing it, Dr. Joseph.
You're welcome.
I'm so glad you exist. Like, you are just filling a need that is incredible. And I'm so glad that I got to meet you and that Dr. Knopf introduced us.
Likewise, I absolutely love working with all providers on the spokes of the wheel that I talked about earlier. I think it just makes the patient's experience better and it levels up our healthcare. Our system is not a very well-run system right now. There's a lot of problems in it. I'm probably preaching to the choir of all the people on this call. And if we as providers can really work together and be those different spokes on the wheel to help people experience change, that is my number one goal. Relief is possible.
Thank you for the work you do. Thank you for coming.
Yes, thank you for having me. This has been wonderful.
It's been absolutely a pleasure. All right, this was Doc Talk. I'm Dr. Hannon.
And Dr. Knopf, we'll see you next time.